of course, today is Tuesday, and as you guys know, it is Rundown Tuesday. We've got Health City, who's going to be joining us here in just a second. These segments are, I think, appreciated by all. We all look forward to learning a thing or two about, good health and wellness and all of the amazing things that Health City has to offer the community. Now, I didn't get to really talk about this yet, but on Thursday of last week, I finally had an opportunity. I've been trying to get there to visit the oncology center there in right by Cayman Bay. So I think it's part of the Cayman Bay complex, in fact. And wow, it is. I was blown away. It's an amazing facility, so professionally done. The latest equipment, and having a tour of the facility and having the opportunity to speak with the people who are working there, who are making this service available to the people of the Cayman Islands, is just absolutely amazing. So we're going to actually be talking about oncology, surgery and so on this morning. But it's just, I was blown away, that this is actually being offered on our small little island of like 70,000 people, that we have this cutting edge technology, which makes it so much easier for people to receive treatments without having to go overseas and incur expense and be away from their families and so on. So congratulations to Health City for doing this amazing job for opening this facility. And I was really proud to see, I don't know if you guys noticed the Facebook post that I put up yesterday, but I was really proud to see that they've actually dedicated the facility in honor of Mr. Gene Thompson, who passed away shortly before the official opening of that. So you guys will know that Mr. Thompson was, instrumental in getting Health City to the Cayman Islands. And despite the fact that he was no longer, at the time of his death, with that organization, they still honored him by, in fact, naming the facility after him. So it's the Gene Thompson Radiotherapy Center is the proper name of it. So again, kudos and congratulations to the Health City team. So good morning, Senor Shamari. How are you?
Good morning, Sandy. Good morning. I finally get to say my proper good morning after being off air for so long, seeing as my internet's working. I'm not running around. I made sure to put the dog in his section so he doesn't pull out the cords again. But it's really, really great to be here. And, it's a Tuesday morning, and I have my Miami Dolphins cup, seeing as we started the season on the right foot with a victory.
Yes.
This year we were going to win it all and go to the Super Bowl. So I have about 2 or 3 of these cups to have, morning coffee with you every Tuesday.
Okay, very, very good. So did they play one game already? I thought I saw people talking about it over the weekend. I'm not sure.
Sorry, say that again?
No, I was just wondering if they played a game this weekend already.
Yeah, we played on Sunday. We won.
Okay. Well,
First game of the season. So
yes,
we won a big game.
I thought I saw something for sure. All right.
Definitely.
So we've got we do have some guests visiting us this morning. And of course, Shamari, I was just talking about the oncology facility there, the radiotherapy, center. Just blown away and amazed at that.
And the funny thing is, right, whereby you would have seen the machine, which is called the LINAC, and there typically you would need to have one LINAC for 250,000 to 300,000 population in order to get the right volumes for that type of machinery. But Health City, as always, understanding where the gaps rest, looking into the rest of the Caribbean, and knowing that when it comes to cancer care or oncology, that's the highest priced item that you can actually go for, or modality, when you go to, for instance, the US. So we knew that you can't have like a third or a fifth of a LINAC. So we went ahead and made that investment to make sure that we could have that machine here. We could have comprehensive oncology treatment, because that's how you get your best outcomes. And that's why we went ahead and built it. And as you mentioned, obviously we honored the late Mr. Gene Thompson, and naming it the Gene Thompson Radiotherapy Center, just based on the fact that obviously he was instrumental at the very beginning to make sure that Health City reached our shores. And it was just the right thing to do. So we always look as an organization to do the right thing, and bringing it here obviously was the first right, and naming it after him would have been that second right. And Sandy, you saw the facility. Um, I
Mhm.
apologize. I had another meeting that ran over. I would have come to meet you there, but you would have gotten to see obviously the whole facade, everything that happens with the machine, the fact that it's top notch, top
Yes.
quality, and now individuals no longer have to go overseas in order to get that care. And one thing that
Mm.
really surprised us when we first started, obviously, we looked to see how many numbers of cancer patients that would actually need this modality would be needed. And when we first started, we were blown away by persons who were already approved, long before we were ready and open to go overseas to get that treatment. And due to the fact that, may have been a single mother that didn't want to leave a child, or, because you have to do the different fractions over periods of time, even though after the first one, the fractions become less depending on the type of treatment that you're getting. You still
Mhm.
have to go overseas. So people were afraid to, leave their job, or hesitant, I should say, to leave their jobs for so long. So there were persons who were approved for months at a time that were putting it off. So it just shows you that obviously being here now is going to give persons access to the radiotherapy machine that's needed. And the fact that you were speaking about all of the machinery is only as good, obviously, as the different specialists that we
Yes.
have. And we have a holistic oncology setup whereby we have a
Mm.
medical oncologist, surgical oncologist, radiation oncologist, gynecological oncologist, and ENT surgeon to capture the majority of the different incidents of cancer that there will be. And I know you're getting ready to bring on Dr. Jagan,
Mhm.
and Dr.
Yes.
Jagan is actually our surgical oncologist that specializes in oncoplasty breast surgery. He has close to a decade of experience in this area. He's also done 1,200 major oncological surgical procedures. He does complex surgical procedures such as cytoreductive surgery, oncoplasty breast surgery, laparoscopic surgeries for gastrointestinal, thoracic, urological, and pelvic malignancies.
Mhm.
So he's very, very, very well versed. And as you always know, bringing in the A team, he's
Mhm.
also worked on robotic oncological surgical subsites as well. And he
Mhm.
was also trained at Asia's premier cancer institution, Tata Memorial Hospital. So the
Mhm.
number one cancer institution in
Mhm.
Asia. He was trained there as well. And whenever I talk, I always say, you only know you're as good at something if you can teach it. And he also was an assistant professor, which just also highlights the additional specialization and expertise that Dr.
Mhm.
Jagan has as well.
Yes. Well, good morning, Dr. Jagan. I figured after that introduction, we might as well just bring you on. So, thank you so much for joining us. I know this is your first time on the program, so a warm welcome to you, sir.
Good morning, Sandra, and morning, Simori. It was a nice introduction. Thank you for the introduction. I'm happy to be on this.
Yes, absolutely wonderful. So glad to see you here. And of course, I want to share just sort of a personal story that I've actually met Dr. Jagan already. I was telling our listeners, I think it was about maybe 2 weeks ago now, that I had a little bit of a situation with some test results that came back that needed follow up. And so I mentioned in that story that I was so fortunate that Health City had just brought on island recently um, this breast surgical expert. And so Dr. Jagan was able to review my mammogram. He was able to speak to the physician who did the ultrasound and just reassure me that everything was fine. And he really explained it well. I'm not surprised that he has taught, as Shamari just shared, because in fact, when he was explaining things to me, I thought, oh wow, he explains things extremely well. Because a lot of times physicians, they may be knowledgeable, but there's something lost in translation when they have to speak to the average person. And so he was explaining to me that if this was cancerous, these are the things that we'd be looking for. we'd be looking for, the shape being a bit abnormal. We'd be looking for, calcification, like in clusters. And I mean, he just really, really broke it down where I could understand at some level what it was that he was saying. So, of course, thank you so much for. And I know that when I went there, it wasn't planned that I was going to see you, but Dr. Benoit said, "Hey, while you're here, have the premier expert look at your results and just do a quick consult with him." So thank you so much, Dr. Jagan, for that. It really put my mind at ease as well.
Thank you. It was so nice of you to tell this in this public forum. And I'm happy that you got the point what I was getting across. I'm very happy if patients know what they are going through and what needs to be done for them. That's it.
Yes. Absolutely. So we're going to be speaking this morning, and we also have Dave O'Driscoll who's joining us as well. And this morning we're going to be talking about, the whole area of oncology. So we some people said they can't quite hear you. Unfortunately, I don't know if there's anything you can do to kind of increase your mic levels at all. Um, but if you can make a little adjustment. But Dave is joining us. He's operations manager for the Cayman Islands Cancer Society, and he's going to be joining us in studio this morning as well. Good morning, Dave.
Good morning. How is everybody?
Not bad. How are you?
I'm very good now. Thank you for having me.
Yes, absolutely. So let's discuss this area. It's something that people, I feel like we should be more aware of. Surgical oncology. So when we hear that word oncology, some of us have an idea of what it is, others may not. Dr. Jagan, can you tell us, as a consultant surgical oncologist, what exactly is it that you'll be doing as part of the Health City team?
Uh, Surgical oncology is a field that deals with cancers in all parts of the body except for the brain or the heart. I do all cancer surgeries, right from breast, lung malignancies, even intestinal cancers, pelvic cancers, or soft tissue sarcomas, and all kinds of cancers except for the neurosurgery part of it, the brain surgery part of it. So, and it depends on the site of the cancer, the modality of the treatment changes. If it is a gastrointestinal or a thoracic cancer, we can do it laparoscopically, or video assisted thoracoscopic surgeries can be done.
Mm-hmm.
For breast cancer, straightforward surgery, and with oncoplasty. Oncoplasty is nothing but some kind of plastic surgery which is done along with oncological resection of the tumor. So it depends on where the cancer is, and surgical oncologist is trained in all these subsets of all kinds of organs to deal
Mm-hmm.
with cancer. We deal with only cancer.
Only cancers. Okay. All right. So, and that includes everything from gynecological, breasts, what other radiation oncologists, there's an ENT surgeon. So pretty much most of these surgeons will fall under the surgical oncology umbrella.
Yes. Head and neck cancers and even gynec cancers as well. In the head neck cancers, we do along with the team. We have our ENT surgeon trained in head neck as well. So do as a team. It's always a teamwork. Oncology is about a teamwork. Not only surgery does everything,
Mm-hmm.
along with my medical oncology and the radiation oncology colleagues. Only when you have all modalities of cancer treatment, you can achieve cure and you can give the best to the patient.
Mm-hmm. Okay.
Sandy,
Yeah.
Sandy, Dr. Jagan, I don't know if you can possibly take out the headphones and just try the speaker
Right.
directly from the
Maybe.
computer, because I'm getting some comments as well that persons who are listening can't hear you that well.
Mm-hmm.
Can you hear me now? Is it better?
Oh,
I
perfect.
think
Yeah,
that's
much
better.
better.
Yes.
Much better. Perfect.
All right. So I think maybe just repeat what you just said for us in case people missed the benefit of really explaining what surgical oncology encompasses. And you say that obviously it goes beyond that because you're working with a lot of other medical professionals as well.
Sorry for the voice interruption.
Yes.
Surgical oncology is a field that deals with cancers in all parts of the body except
Mhm.
for the brain and the heart, inside the heart. So, starting from the head to toe, all head and neck cancers, thyroid, tongue cancer, oral cavity cancers, and
Mhm.
laryngeal cancers, Next, you come to the chest and thorax. Chest, we deal with breast cancers, and thorax, lung cancer, and mediastinal tumors. Then you come to the abdomen. It is the intestine, the colon, and the rectum. And the gynec cancers are obviously ovary and the uterus. And when you take the limbs, like you take sarcomas. Sarcomas are the cancers which arises from soft tissues like muscles or sometimes in the bones as well. So I was trained in all these cancers. So I was practicing all this. So,
Mm-hmm.
and in fact, in our team, we have one head and neck cancer expert. We work as a team when we do head and neck cancers. I usually say that oncology is a teamwork. Uh, Surgery is a part of it. Medical and oncology and the radiation oncology, along with all the three modalities, only you can achieve cure in cancer patients. So it's
Mm-hmm.
always a teamwork.
Yeah. So you're part of a team of professionals. So absolutely, thank you so much for that. So over 50 persons so far have received treatment on at the facility we were just talking about, which is the Gene Thompson Radiotherapy Center. That seems like quite a significant number because you've only just recently opened.
Yes, exactly. Initially, we never thought that this many numbers are waiting. So
Mm-hmm.
all these people would have waited long enough to reach somewhere abroad, and they have to wait to start their treatment, and they have to take off from their job as well. So as
Mm-hmm.
you initially mentioned that they can continue their work pattern, whatever it is, just go in the morning, take radiation. It's like a CT scan or something like that. They don't feel anything. And
Mm-hmm.
most of my patients are very happy having a radiation center here, and they're very excited to get the radiation here and continue their work, so that financially also they are not affected by not losing their job or things like that.
Right. And
And
it was
Sandy,
interesting.
sorry, Sandy,
Yeah.
just to mention that
Mm-hmm.
obviously when we mentioned that we wanted to bring the radiotherapy center closer to town, just due to the
Mm-hmm.
fact that 70% of the population still live in Georgetown and Seven
Mm-hmm.
Mile Beach, West Bay, but also during the workday, 95% of persons will
Mm-hmm.
be in and around this area. We even opened the radiotherapy center earlier than we first anticipated, just for that, for persons when they need to have the 15 minutes worth of radiotherapy, they can come in, have their 15 minutes, and continue with their day, whether it's to go back to work or to carry a child to school or to deal with the elderly patient. We're just making it as flexible and as user friendly as possible
Mm-hmm.
for the actual community. And to Dr. Jagan's point, we obviously knew and had a a handle on the numbers that we thought we would see. But what really shocked us and once again drove home the point of why it was needed is that
Mm-hmm.
persons had been approved, right? And insurance was paying for it. And they just needed to go overseas to get it. But there are all the other social factors that were playing that they just didn't. Right. So at times, we don't put our health to the fore. And now by it being here and being so close, a lot of those persons who may have put it off when you shouldn't will no longer need to put it off, and they can get it right here at home, go home every day, be with family.
Mm-hmm.
If they don't want to take time off of work, they won't have to take time off of work, and those sort of things that you don't really think about when you're putting a radiotherapy center here in the Cayman Islands.
Mm-hmm.
One more thing,
Yes.
radiation will take minimum 6 to 8 weeks time. So
Mm-hmm.
the treatment itself is a longer duration. It's not like surgery, or it's not like chemo which you take every once in 3 weeks or things like that. So it is good that we have a radiation center here.
Mm-hmm, mm-hmm. And I was quite surprised, not really knowing much about the process of radiation, how incredibly safe the facility is. I mean, your team went through and explained quite a bit about the measures that are taken to ensure safety, and also to just target the very specific cells that they're looking to treat. And a patient gets to walk away without any pain or severe discomfort, or like you said, they can go back to work, Shamari. They can continue in their day. They can drop their kids off. I mean, this seems quite an amazing treatment.
No, definitely, definitely, and as I mentioned, we knew that obviously it would be a benefit. We just didn't realize that persons were actually putting off treatment, to doctor's point, due to the fact that it takes from 6 to 8 weeks. So you're not going to be traveling back and forth,
Mm-hmm.
but you'll be going there for an extended period of time. And usually, if you're lucky, you may have one family member with you who can take that amount of time off. Many
Right.
times, you may have nobody or just one person. Whereas in when it's here in Cayman, you have that family support that's so important when it comes to healing as
Mm-hmm. Dave, joining us in the Cayman Islands Cancer Society. Good morning to you.
Good morning. Good morning. Yeah, I was just about to add to that as well. That
Yes.
a lot of times when we have people coming to us for financial aid,
Mm-hmm.
because they're looking to have treatment done, and they would have to go overseas, their insurance can only cover so much. Many
Mm-hmm.
insurances wouldn't cover the flights, the accommodation, the travel to and from the hotel, and it definitely wouldn't cover having a companion or a partner travel with them, and basically keep the company for the 6 to 8 weeks. And that that trip itself, like let alone the actual treatment, can be very hard and laboring on somebody. And you have people coming back from that after 6 to 8 weeks. Um, Obviously, lucky enough, we were able to cover them for all the costs. But they come back from that in a much worse condition than if they were able to do it here while being able to go home every night and be with their loved ones. So it can make a massive difference to just a patient's psyche and their well-being and their kind of their attitude towards the treatment.
Sandy. I think you're on mute.
Yes, my apologies. Thank you. No, I was just saying that I can definitely imagine being away from home, and even just your routine, adds a certain level of stress to your life on top of having to get cancer treatment. So it's so interesting, Dave, that you talk about, knowing firsthand the people that are definitely benefiting from having this treatment available right here in Ireland.
Yes, yeah, very much
Mm,
so. We try to keep in contact with our patients when they do go off island, and you can, they're obviously trying to be as upbeat as possible, but some of them they don't have the strength mentally to go through such a big change, such a big trip. They wouldn't even do it if they were in the best of health. A lot of these people, and suddenly they're just thrown into an adventure that they're not really willing to take up.
mm,
So to have something like this, and obviously the next step is we need to work with the insurance companies to make sure that they see the huge benefits in this in terms of keeping the patient safe and secure and comfortable as well while they're going through this
mhm.
awful life experience.
And don't forget, folks, you can join the show 936-2626. Miss Debbie says congratulations to Health City. We also have Leanna said that she thought when I said rundown that I was talking about food this morning. Not quite. I know we talk about food a lot on this program, but not today. We also have Chris Malloy who's joining us, and Chris says hello from Boston, Massachusetts. The Malloy family had a great experience with Health City, saved my wife's life, outstanding institution, and congrats on the Dolphin win. He says that he had a great hospital, great personnel across all aspects of the institution. Who would think that such a terrible health scare would leave us with such fond memories? I think such fond memories of the island and the hospital. Congrats again, and he says enjoy most likely one of the few you'll have this season. Oh, go Patriots! So sounds like you got some competition there, Shamari.
Yeah, that's a rival there, a Patriots fan.
Yes.
But no, Chris Malloy, many years ago, we need to probably get him on the program.
Yeah,
His wife
absolutely.
had a serious health scare. They rushed her up off of a cruise ship. They
Hmm.
rushed her up to Health City. We were able to do what we do and save her life. And he's been a close friend of the Cayman Islands and Health City ever since him, his wife, and all of his children. Really touching story. So one of these days we'll reach out to him and have him come on and with his wife to tell the story that he
Hmm.
loves to share. Yeah.
Wonderful. All right. So again, folks, we're having a discussion around surgical oncology today. If you have any questions, please do feel free to give us a call. So surgical oncology, the goal is to remove the cancer cells from the affected area. So Dr. Jagan, sometimes surgery might be the way to go. Is it normally the case, though, that you're going to do surgery in combination with other types of treatment?
Yeah. Surgery is the main part of the treatment, because you have to remove the cancer out. The
Yes.
other treatments will take care of what cannot be removed or what cannot be surgically resected. Like chemotherapy acts on all the cells which is not seen through eyes, which is in the bloodstream. Same way, the radiation also acts in the cells which are not seen, or which cannot be seen and removed by surgery. The ideal way for any tumor, when it is surgically resected, that is the first part of the treatment, and if that is done as the best way, that ensures cure in most of the patients.
Mm-hmm. And that's why you're talking about, it's a team effort and you have all these different specialists working together, because you bring all your collective knowledge and expertise to look at a patient's case and look at their specific type of cancer, where it's located, and what treatment modality would actually work best for that individual.
Yes, absolutely. So everything plays a part in getting cure for the patient. Every step in cancer treatment is already measured, and it is studied in multiple times, and then it is practiced. So surgery, chemotherapy, and radiation are integral part of most of the cancers. In some of the early cancers, we might be able to avoid chemo or radiation. That is in a very early stage or in a pre-malignant stage. Pre-malignant stage is the stage before the cancer arises. In those stages, surgery would be enough. But all rest of the cancer treatment will encompass both chemotherapy and radiation as well. And people are sometimes afraid about taking chemotherapy and radiation. I'll tell you, both the things have been very much advanced now compared to what it was 20 years ago. The side effects are very less, and radiation, I hardly find any side effects of radiation in our patients. Even chemotherapy is gone far away. So people do not worry or fear of getting those treatments. My aim is to, if the patient completes all the treatment, then that is the best thing that can happen for the patient, so that we can aim for the cure, or we can aim for control of the disease for a longer duration of time.
Right. I was quite surprised, Dave, when I did the tour of the facility last week, to hear the expert tell me that there is a pretty high incidence of cancers, particularly breast and prostate, on this island. Do we have any idea what could be driving that, and what's going on, really?
So,
It's very hard to tell.
Mhm.
Our numbers have increased significantly in the number of people that we actually provide financial care to. So that means there are more and more people coming to us who need financial assistance to pay for their treatments, their testing, their diagnoses. Um, there's a lot of factors. You could put it down to a lot of people struggling to, as they get older, to increase their insurance premium as we usually would. This premium would obviously cover more kind of outpatient treatments, which cancer diagnosis starts with, with PET scans and MRIs and CT scans. Obviously, COVID in 2020, a lot of people had to dip into their savings a lot, and it really did kind of set them back a couple of years in terms of their family planning and their insurance coverage. So that's one thing we were thinking of. It's very hard. I hope to God it's not the big expansion of the dump that you can see right outside of the Health City, which isn't the best looking thing in the world. But no, we don't really know. Again, also our population is increasing exponentially over the last couple of years as well. We went from an apparent, was it 55,000 after COVID, and now we're back to over 70, with no signs of it stopping.
Closer to 82 is what I hear, but
is that it now? That's So,
but your point is definitely taken.
Yeah.
Yeah, that was
might be part of it. Yeah.
Yeah, that was going to be my question to Dave. Obviously, based on cost of living and disposable income reducing, maybe obviously population growth and everything else, but maybe a few years ago you would have had enough in your savings that you could have covered some of these tests, whereas now everybody is going paycheck to paycheck. And therefore, if you have an incidence of cancer, you may need more help today than you would have needed previously. And this is probably also points to why certain medical professionals and the such are talking about having a cancer registry, just because, at times you may think that the incidence is higher, but without proper registry to be able to identify how many cancers in what areas and the such, it's a little bit more difficult to do that analysis. And I know in Cayman as well, just due to the small nature of the Cayman Islands, when you're in a larger city, many people may have cancer, you may not know them. But in Cayman, you always know somebody who knows somebody who says to you, oh, so and so has cancer, in a small society. So at times, you wonder whether or not is it truly that it's the incidence is higher, or is it just that we kind of know everybody, right? Third degree of separation.
No, you're hearing the story 3 times.
And you're hearing the story 3 times as well.
But the medical professionals are saying that the numbers are definitely higher, based on their experience, probably in other jurisdictions and stuff. But this is where, Dave, perhaps you can give us some idea of what the Cayman Islands Cancer Society do in terms of collecting data or information, like who in the medical profession is collating this information so that we can, have more accurate numbers to work off of.
Well, that's it. As you know, or if you don't know, the cancer registry itself is based at HSA. You are not obliged to register yourself with the cancer registry once you discover that you have cancer. It is strongly recommended. Every country in the first world, it is mandatory that you sign up to the cancer registry once it is proven that you have cancer. This has so many benefits in the long term for the population and for the fight against cancer globally even. They need to have the information, they need to have the stats, they need to have the data, so that we can find out what cancers are occurring more often, especially in different regions of the world, like here now in the Caribbean. So there's no, obviously all this information is anonymous. So there's no reason why if you do discover that you unfortunately have cancer, one of the first things you should do after you've obviously sorted out all your testing and your scheduled treatment is give the cancer registry a call and get your details logged into their system, so that it can benefit the rest of the population, and hopefully we can move forward with make better inroads with better information.
I think that it's from some of the things that I've heard, it's one of those things where there's a lot of misinformation about the registry and kind of perhaps how the information would be utilized. And like you said, you can completely remain anonymous. And I also think that it's a bit of a mindset of people on this island that unfortunately never want to share information. I mean, I know the ESO struggles on a regular basis when they have to do, whether it's the every 4 years they do the big survey. What's it called again? But the big census survey. And then in between they do smaller ones for like business. They do a workforce labor survey, and they really struggle to get people to participate because I don't know, there seems to be this mentality that I don't want to tell anybody, what's going on in my life.
Yeah, I think the first mistake they made was, and I guess, looking back, you think, all right, well, it's fair. It's a democracy. Let's give people the choice if they wanted to submit their details or not. I think that was one might argue that was their first mistake. In every major country in the world, they didn't start with that. They just, passed a law. Look, when you have cancer, you need to write it down. We don't care about your name. We don't care about your name at all. We just need to know the cancer. We need to know the details about the cancer and nothing else. Yes. We don't want to know who you are, who you're married to, who your brother is. But unfortunately, when you leave it open to debate, then you get questions will start arising that have no right being in the conversation in the first part, and then it spirals out of control, and unfortunately, then you get a bit of an opposition.
Right. Yeah. And I think again, it's like a mindset or a way of thinking about things that maybe is a little bit unique and different here in the Cayman Islands. But let's talk now about breast cancer and surgical oncology, Dr. Jagan, specifically relating to breast cancer. So, what are some of the treatment options available for breast cancer patients in 2023?
First, I'll start with surgery for breast cancer.
Mm-hmm.
There are two types of surgery which can be done for breast cancer. One is removing the whole breast. The other one is removing only the tumor along with some normal tissue margins. So now people tend to ask me whether I need to remove the whole breast, but that is not the answer for all patients.
Mm-hmm.
Because of the advancement in chemotherapy and radiation, we can avoid removing the whole breast for all patients. Almost
Mm-hmm.
every patient, you can downsize the tumor even if it's big and do
Mm-hmm.
a breast conservation. Breast conservation means we just remove the tumor along with margins, and we can do a oncoplasty along with it. Oncoplasty is maintaining the shape of the breast with our own tissue. The tissue might be from the tummy, or from the back, or within the breast itself. So it
Mm-hmm.
depends on how big the tumor is and how much the resection volume is. So all said and done, removing whole breast is not the answer for everybody.
Mm-hmm.
It will be needed only in few occasions when there is some higher family risk, or other tumor factors which is decided. But blanket treatment of removing whole breast for everybody is not recommended. You can remove only the tumor, and always the chemotherapy and radiation is going to be given as a part of the treatment, and you will receive hormone therapy if you have hormone positive cancer. So all that will take care of the microscopic disease which is not seen. Even after removing the whole breast, all these treatment will be given. So you are
Mm-hmm.
not going to avoid any of the treatment by removing the whole breast. Some people
Right.
have a strong myth that when we remove the whole breast, we are away from cancer as well. Like, you don't have
Mm-hmm.
a chance of recurrence or things like that. It doesn't go that way. Only one with a strong family history or genetic risk, then there is a risk of the breast cancer coming again the same breast, and that's why we recommend to do a mastectomy.
Mm-hmm.
Mastectomy is removal of the whole breast. In all other patients, we can get away by conserving the breast and giving this adjuvant treatment like chemotherapy and hormone therapy and radiation. And people can it affects them mentally as well. If you remove the whole breast, you have to reconstruct it with a bigger tissue and a bigger surgery as well.
Mm-hmm.
And physical appearance do affect people in the longer run. So I don't recommend removing whole breast for all patients. Only when the tumor is at a higher risk or when the genetic factor is there, then only I will recommend to do a mastectomy for a patient. It all
Mm-hmm.
depends on the tumors, and most of the tumors, 80 to 90%, we can get away with only removing the breast lump and reconstruct it with our own tissue. Our own tissue is the best material to get reconstruction with,
Mm-hmm.
because once it is healed, you don't need to worry about it.
So we're talking about a lumpectomy versus a complete breast
Mastectomy.
removal.
Yeah.
Yes. And the thinking is obviously it's specific to the patient, but oftentimes the lumpectomy will be just the most effective way to deal with it, along with other treatment options.
Yeah, and there is a myth that if you do a mastectomy, then you can
Mhm.
avoid chemo or radiation. That is not the fact. You are
That's
not
not
going to
true.
avoid anything by doing a mastectomy.
Mhm.
Mastectomy is not to avoid these treatments.
Right.
These treatments are part of cancer treatment. As I told you, whatever is not seen through the eyes, that
Yeah.
microscopic disease is taken care of by chemotherapy, radiation, hormone therapy. All these adjuvant treatments are given so that the cancer doesn't come back. So
Mhm.
cancer recurrence need not happen only within the breast. It can happen in the lymph node. It can happen anywhere in the body. So only removing the whole breast is not the answer for everybody. That's what I'll tell you.
Mhm.
That
Mhm.
each patient has to the treatment has to be tailored according to the tumor and according to the age and other risk factors as well.
Hmm. Okay. All right. We've got Brenda who's joining us, listening from Antigua this morning. Good morning to Brenda. So good to see you. Thank you guys so much for joining the show. I've noticed this morning that some of you on Facebook have like a little link by your icon. I'm not quite sure what that link means, but is it like a verified account? I don't know if Facebook's doing something new, but I noticed that Brenda had one, and so did Chris. So we'll have to figure out what that is. All right, very good. So talk a little bit then about, I think a woman's breast is so connected to who she is as her identity for a lot of women. as a community, as a society, we seem to prioritize breast for more reasons than one. So not just the function of being able to breastfeed, but they have a function of whether or not you found to be attractive. There are women who will go out of their way to enhance the size of their breasts and so on. So I think that when a woman has breast cancer or needs any kind of breast surgery, you know, she's left feeling different about who she is as a woman. And I suppose this can be an extremely difficult situation. Do most women opt to have some form of reconstructive surgery after going through something like a mastectomy or lumpectomy?
Yeah, there are various options after lumpectomy and mastectomy. After lumpectomy, it depends on how big the resection volume is or how big the tumor was. Depending on that, we can refill the space with tissue from the lateral side of the chest, or from the abdomen, or from the back. If you are doing a mastectomy, you might need to put a tummy pad towards the breast, creating a new breast. That is called whole breast reconstruction. And I could see some implant images in the picture, but implants, I don't advise implants for my patients as such. I keep implants as my last option because implants do have some problems. There are implant failures, implant contractures, and the wound breakdown because of the implant. All said and done, implant is a foreign material to our body. Putting our own tissue is the best ideal way of reconstruction. Implants can be a stopgap to do a whole breast reconstruction, but it cannot be a permanent solution. If I give you the statistics, if there are 100,000 implants which is put in United States, 40,000 of them undergo resurgery for the implants. So it is like you're going to be put under knife once more. So implants is, see, breast is a dynamic organ. So it is a mobile organ. So if you put an implant, one side of the breast will be something different compared to the other side. If you put an implant for one side after mastectomy or things like that. So all said and done, there are some lot of negatives along with the implant, and there are some tumors which have come back because of implants, lymphomas, which is called as large cell lymphomas, which have been reported with implants, which is not shown by the implant companies or things like that. So implant can be a stopgap for a permanent solution, but I don't think implant is a permanent solution. Unless otherwise we don't have any other option, like patient has undergone multiple surgeries and you don't have any other tissue left or things like that, then I can accept that implant can be put because they don't have any other options left. But I don't prefer it as a first option. When you have other best options available, better use the best ones and keep implant as a standby or an option when it's not available, when other things are not available.
Okay, very, very interesting. Thank you for that. And I know of a few people who just decide to do nothing. They do the surgery and they might use like a just an implant, like the ones that you just put in your bra cup to kind of make sure that your clothes look okay. And they say, hey, you know, if a man finds me less attractive because of this, then so be it. And they just you know, live with that. So I think that that's also, I suppose, an option as well. All right. So, as always, you know, we want to talk about how we can reduce our potential risk associated with different types of cancers. So, let's go through this list. I think most of us will kind of know some of this already, but it's great to just kind of reiterate the things that we need to do. Dave, I'm sure you guys at the Cayman Islands Cancer Society must do educational programs where you're encouraging people to live healthier, more active lifestyles, because all of those things will undoubtedly, you know, benefit them.
Yes, absolutely. It is one of the few ways that we can actually we can help in that way, because none of us are doctors or surgeons down at Cayman Islands Cancer Society, unfortunately. But we have our biannual public health fair happening next week on Saturday, September 23rd. And this will really be an opportunity to learn more about keeping your body healthy, what fuels your body, and what gives your body better strength to become more immune and to fight off all diseases, not just cancer. So we will have all different medical organizations, companies, clinics. We'll have fitness studios. We have health food manufacturers, all down there giving off free samples, so free food samples, We will have a lot of the other nonprofit organizations as well giving us a hand by providing
Mhm.
free screenings. You're talking blood pressure, BMIs, diabetes, glucose, screenings for skin cancer, hearing, sight. All this is free, and it's at the Marriott from 9 a.m. to 2 p.m. Absolutely free to the public. So come on in. We also will have presentations going on all day long from speakers coming from our sponsors. There are even a couple of hospitals overseas who have been so nice to come down and help us out with this. And we will have all little talks about every kind of subject you can imagine that has to
Mhm.
do with keeping your body healthy, keeping your body strong, fighting off diseases like cancer and other very, very threatening diseases. It's a great opportunity to learn a lot. I know as a man now in my 40s with a young family, suddenly my health is paramount, not because of me, but because of my children. And I want to be
Mhm.
strong for them, and I want to have the knowledge myself that I can impart to them so they can then also lead a healthy life and make the right decisions. So
Mhm.
I hope that I see anybody my age and all my friends down there because you'll definitely learn a thing or two.
Wonderful. All right. So make sure you mark your calendar for that event. And will you send that to us as well, so that we can add it to our CMR community calendar, which is available on our website?
I would love to. Thank you.
Yep, absolutely. So let's go through some of the things that you can do. Take ownership of your own health, folks. Number one, be aware of your own individual health risk as well as your family risk. So again, know your medical history, know if there's any instances of disease, particularly cancers that run in your family. Having that information can be extremely beneficial. So, Dr. Jagan, like in my case, for example, I've got two females in my family now, at least that I know about, that have had breast cancer. How much does that increase your chances? So, one is my mother, but she was like in her 80s. So, age, obviously, you have to take that into consideration. And one was a much younger sister who I think might have been early 40s when hers was discovered. So for myself, how much does that increase or impact my chances?
See, if a family member is diagnosed with cancer in
Mhm.
less than 40 years, then your chance increases by it multiplies by twice compared to the others. So,
Mhm.
and if you have more than two family members affected less than 40 years, then your chance multiplies by 5 times.
Wow.
Two members, more than two members, less than 40 years. Okay.
Uh-huh.
So in your
So the
case,
the
your
younger the person, the more significant it is, and if
yeah,
it's two people, then you're looking at a higher risk if they're younger.
yeah. Always these
Mhm.
familiar cancers or the genetic cancers occurs in a younger age group rather than an older age group.
Mm.
Older age group happens as such as, but the
Mhm.
younger age cancers are mostly associated with some family history or some genetic defects.
Mhm. Hmm. Very interesting. Reduce alcohol consumption. So, what is it about alcohol that increases your, instance of cancer?
The strongest association of alcohol is with liver cancers. Once you consume alcohol, they'll end up in some amount of liver failure.
Hmm.
It's amount of alcohol and the duration of alcohol they have taken it. Once the patient ends up in liver failure, they call a term called cirrhosis. The
Hmm.
cirrhosis will turn into a cancer. That is what alcohol, liver cancer is strongly associated with alcohol. If you take alcohol for longer duration, then you're prone to have a hepatocellular carcinoma that is called a liver cancer. And alcohol is associated with other cancer as well, but the strongest association is with the liver cancer.
And does it matter what type of alcohol? Because some people think, oh, if I drink fancy wine versus hard liquor, somehow that's going to make a difference. Does it really matter?
It is the percentage of alcohol that we consume that matters. It can be wine or it can be other forms of alcohol,
Hmm.
but it is the percentage of alcohol that a person daily consumption that matters a lot.
Yes. So it's how much you're actually consuming it, the frequency and how much you're consuming.
Yeah, it is how much and how frequently you're consuming.
Hmm.
That matters a lot.
Hmm. Right. Eating healthy and being physically active. So this is another great one. So we see in the display here a nice picture of balanced meals. You've got your fruits and legumes, vegetables, and so on. So eating a healthy diet, being very, very conservative in how much meat you consume would also be an important part of a healthy diet.
Yes, diet is the most important factor for all your intestinal cancers. Diet is the most important thing. Not only intestinal, even breast cancers. If your BMI is less, the risk of developing a cancer is less. That is what the studies have proven it. So,
Mhm.
keeping an ideal body mass index, you need an adequate diet or an ideal balanced meal along with regular physical activity. These two go hand in hand so that you keep your BMI in a perfect shape. You can avoid developing a cancer. Leave about other medical ailments also, you will be avoiding it, like diabetes, hypertension, things like that. It's about a
Mhm.
healthy lifestyle with a balanced meal and a regular physical activity, daily physical activity.
Right. Okay. All right. And we also have I'm just trying to bring up, hold on a second here. I was trying to do the fancy version of this morning. So we've got doing your regular checkups. Of course, again, this is important because a lot of times cancers are discovered by physicians, right? So knowing what a mammogram looks like last year versus what it looks like this year, these things are important. Whether you're going in for your colonoscopy, you can find polyps early enough to do something about them. So early detection really comes down to regular screening.
Yes, screening is the most important part of cancer treatment. Once we develop a strong screening setup, we would avoid, or we can stop seeing these cancers being detected. We can detect in a stage where before cancer develops, or we can
Mhm.
prevent it. So that is the ideal way to go about. As you said, mammograms to be done early basis, and colonoscopies are more than 45 years. For cervical cancers, you can do pap smears every 3 years, and for prostate cancers, you can do a blood test called prostate specific antigen, so that you can screen all. If you screen it and pick it up in an early stage or a stage before it comes, that is called pre-malignant stage, then you can achieve cure, and they can have the normal lifespan.
Mhm. And it's specific to breast cancer, the ability to be able to breastfeed and limit postmenopausal hormone therapy, also seen as important steps to reduce your cancer risk.
Yeah, for breast cancer, breastfeeding is the most important risk factor. If they don't breastfeed, the chances of getting a breast cancer is high. Breastfeeding is a preventive measure, so whoever has breastfed a kid for more than 6 months, their chances of cancer significantly comes down. That is what all the previous literature quotes it, and it is seen as well. Then
Mhm.
hormonal therapy for longer duration is not good enough unless otherwise advised by a physician for some indication.
Mhm.
Taking over-the-counter pills for as a contraceptive hormonal pill for longer duration is not ideally advised.
All right, very good. 936-2626. If you have any questions for our experts or Dave from the Cayman Islands Cancer Society today, please give us a call. So, and just like that, we've got Denny joining the program. Good morning, Denny.
Morning.
Hello.
What effect does the long-term use of the pill have on the hormone balance of a woman?
Okay, so birth control, Dr. Jagan.
Yeah. See, breast cancer is most of the breast cancers are hormone dependent. It grows because of the estrogen and progesterone.
Mm-hmm.
So if you take hormonal pills for longer duration without a physician advice on your own for some contraceptive or things like that, you are changing the hormonal balance in the body. So
Mm-hmm.
once hormonal balance is lost, then your normal cells will start losing its signals to grow normally. So the change in the growth of the cells happens. That's where at a longer duration of time it changes into a cancer. So basically, you are inciting a normal cell to become a cancer just because you're doing something which is not required for the body. So body has a normal hormonal balance. So you're just disrupting the balance. So that causes the cells to grow haphazardly. If a normal cell grows haphazardly, that becomes a cancer. So that's why hormonal pills for a longer duration, unless otherwise it is indicated for a specific condition or a reason, is not recommended. It is
Mm-hmm.
always an advice you have to follow. And same way, we give hormonal treatment for breast cancer. For the breast cancer, should not come back. That is something different from the hormonal pills which you take for contraception or a birth control.
Mm. Hmm. Okay. All right. Denny, any further questions?
Well, I wasn't really able to hear him that well, but
Mm-hmm.
I'll just leave it at that for now.
Okay. All right. 936-2626. We're going to be wrapping up here in a second. Shamari, of course, people, Siobhan says she's listening intently. I know that a lot of people are listening to the program this morning, seeing how they can get more information. One of the things that you have running the promotional specials right now is the senior health check. So, of course,
Yes.
getting in there and getting all those things checked, all the examinations that are available. Tell us a little bit about the senior health check.
Definitely. So, just to remind people that they need to book before September 17th, but you can actually see the physician and booking your time prior to September 30th. Patients must be 65 years to qualify, and it includes routine blood tests for bone health, memory, vascular disease, a ECG for the heart, urine analysis, stool
Mm-hmm.
test for occult blood, and the consultation with our mature elder physician that will be able to tell you exactly what the results mean and if you need anything else. He would have been on the program with us last week,
Mm-hmm.
and it's had quite a good take up, and a lot of people are calling me about their parents and
Mm-hmm.
otherwise. But just want to mention info@healthcity.ky. Or you can go ahead and call 640-4040 and tell them that you want to take advantage. 250 US, right? And you get all of that included, to be able to make sure that we're checking everything for
Mm-hmm.
your parents, your grandparents, or whomever you think would definitely benefit from the seniors health check.
Fantastic. I've actually just thought of somebody that I need to get registered, but I'll message you off here about that one.
Yeah, no problem.
Yeah, fantastic. So again, folks, this is quite a deal. $250 US. You get this opportunity to have a fairly comprehensive health check. You've got to be 65 or over to qualify for it. You do have to book it from now. So I think that that's important to note
Correct.
before the 17th of
Correct.
September. So that is I think that's like Sunday. So you've got between now and Sunday to get the bookings. The only thing you need to do to qualify is be at least 65 years of age.
Yes.
Mm-hmm. Wonderful. Okay, fantastic. And he went through all of the stuff that's included in it. It is quite a bit. So again, I think that's an amazing deal. Thank you guys so much, Health City, for offering that. So any final thoughts, Dr. Jagan, from you as you start to, get to know a little bit more about the community and you're starting to see patients here in the Cayman Islands?
See, we as a comprehensive cancer center can deal any kinds of cancer and any kind of recurrences or cancer that comes back. So anybody can reach out to us, and we have an excellent team of our medical oncology and radiation oncology along with me working together, and we would be able to give the best to the community.
Mm-hmm.
We happy to welcome anyone who is in need of any kind of advice or treatment with
Mm-hmm.
respect.
All right, Dave, tell us how people can reach out to the Cancer Society. Do you have, a Facebook page, social media?
We have it all. Yes, we
Good.
are thriving in the 21st century. We have Instagram, Facebook, our website, very easy, cics.ky. If you want
Mhm.
to email us, it's info@cics.ky. Give us a call. We're always there to chat. If you need some guidance, some help, or want to know where you stand in terms of your finances and your insurance as well. We know a lot about insurance that some people don't, and
Mhm.
all the pitfalls that are therein. Give us a call on 949-7816.
Mhm. All right, fantastic. Okay, well, thank you so much. We really appreciate you coming onto the program again and sharing this amazing information with us. Shamari, as always, we appreciate you being here. Any final words for us today?
No, just I thank you for our guests coming on, and just to say that the Cancer Society has done so much good for so many people over so many years that we're forever indebted to you as a country as well, and the society, and we look forward to in partnership with them. That now I'm sure they're very excited that we have the radiotherapy center here on island. But outside of that, all of the machinery is only as good as the specialists, and we have specialists across the full spectrum: medical, oncology, surgical, radiotherapy, from a gynae perspective, as well as ENT. So we're covering the majority of it, which will not only mean that you have greater access, but it's going to also be more affordable, cost less than going overseas and the such. And the fact that we're here, and working with the Cancer Society, if there's ever an issue with insurance, between our organizations, we'll be able to work with you to make sure that you access the treatment that is needed. With that, Sandy, we'll see you next week.
All right.
And
Sounds
look
fantastic.
forward to that.
All right. Thanks very much, guys. Stay tuned.